Hello, today we're going to be talking about bladder carcinoma or bladder cancer and urinary incontinence. Some of the symptoms of bladder carcinoma that you're going to be looking for are going to be possible painful burning sensation when you're urinating, frequent urination, which you know what that means for yourself. Generally speaking, peeing more than 8 times a day or being frequently awoken during the night by needing to urinate is a good sign that you have frequent urination, hyperactive urination. Um, as well as feeling like you need to urinate but you're not able to pass urine. As far as diagnosis, what we do, there are multiple different ways a person can have bladder carcinoma diagnosed. A cystoscopy is one of them, which is where we enter through the urethra and do a visual examination. Another way is during a cystoscopy, you can collect cell samples and a biopsy can be performed on those samples, which will then be able to tell us whether or not you have cancer cells. Urine cytology as well would be a nice way, which is us using a microscope to identify cancer cells in urine. CT scans are also a wonderful tool that we used for identifying cancer. For bladder carcinoma treatment, it's really just going to defer how we go about that treatment, what stage we catch the carcinoma at. If it's caught early enough, just a transurethral resection of the bladder tumor or a TURBT should need to be performed along with a cystoscopy every 3 to 6 months. The TURBT is just going to consist of us putting you under anesthesia and removing those bladder tumors with a special tool that will be run through that cystoscope. For later stage bladder carcinoma, the treatments you'll be looking at would be radiation therapy along with the TURBT and all that it contains. For some, though, who are the late stage 3 or 4 bladder cancer, being part of a clinical trial is what we recommend, just because it's almost terminal at that point. The long-lasting effects of bladder carcinoma are just going to be that you need to go to your urologist and get your cystoscopies done every 3 to 6 months, because bladder cancer does like to recur. It does not like to stay in remission, so make sure you're getting them done. Outside of that, though, you pretty much just continue to live a regular life after bladder carcinoma. It's not super impeding on your day-to-day life, which is lovely. Alright, so now we're going to be talking about urinary incontinence. Urinary incontinence is the unintentional loss of urine. There are 4 types of urinary incontinence, however, the 2 main ones are going to be stress incontinence and urge incontinence. Stress incontinence is when you sneeze or you laugh or jump or weight lifts, just general physical exertion, and you have bladder loss. Urge incontinence is when you know you're going to pee, but it just comes out of nowhere very strongly, and you lose control of the bladder. So when we're diagnosing urinary incontinence, in both men and women, we look for things like weak urine streams or urination while having sex or laughing, or the inability to make it to the bathroom is also a good note. But we do perform things like cystograms and cystoscopies to help diagnose urinary incontinence. The long-lasting effects of urinary incontinence, most people who have it, they're just gonna live with it forever. It can be controlled with things like medicine, or with women, the vaginal sling is something that can be done, but those are things that are temporary. The vaginal sling only lasts for about 5 to 10 years, and then it'll normally begin to fail in one way or another. But typically the medication will be the only thing that helps suppress the effects of urinary incontinence over time.